Hello and welcome. Today we'll be discussing bladder fibrosis, a condition where the bladder wall becomes thickened and stiff due to the formation of scar tissue. Join us as we explore its causes, effects, diagnosis, and treatment options to better understand this important neurological condition. So, what causes this scarring in the bladder? The etiology of bladder fibrosis is often multifactorial. Chronic inflammation is a major culprit. This can stem from recurrent urinary tract infections, long-term catheter use, or even inflammatory conditions like interstitial cystitis, also known as painful bladder syndrome. Radiation therapy to the pelvic area, often used to treat cancers of the prostate, cervix, or rectum, can also damage bladder tissues and lead to fibrosis. In some cases, autoimmune disorders or certain medications may contribute to the development of this condition. Rarely, it can be associated with schistosomiasis, a parasitic infection prevalent in certain parts of the world. Now, let's delve into the pathophysiology of bladder fibrosis. The chronic inflammation or injury triggers a cascade of events at the cellular level. Fibroblasts, cells responsible for producing collagen, become overly active. They deposit excessive amounts of collagen and other extracellular matrix proteins within the bladder wall. This leads to thickening and stiffening, reducing the bladder's elasticity and capacity. As the bladder loses its ability to stretch and expand, it becomes more difficult to store urine effectively. This rigidity also impairs the bladder's ability to empty completely, potentially leading to urinary retention and further complications. While precise data on the epidemiology of bladder fibrosis is limited, it's generally considered an uncommon condition. Its prevalence is difficult to ascertain because it often occurs as a secondary consequence of other underlying conditions. Individuals with a history of chronic UTIs, pelvic radiation, or interstitial cystitis are at higher risk. Men and women can be affected, although the underlying causes may differ somewhat, with prostate issues potentially contributing in men and interstitial cystitis more commonly seen in women. Due to difficulty in detection, it may be underdiagnosed and the true extent of the problem is largely unknown. The signs and symptoms of bladder fibrosis can vary depending on the severity and extent of the scarring. Frequent urination, both during the day and night, a condition known as frequency and nocturia, is a common complaint. Urgency, a sudden and compelling need to urinate, can also be prominent. Some individuals experience dysuria or painful urination. Because the bladder may not empty completely, a feeling of incomplete emptying after urination is another possible symptom. In severe cases, urinary incontinence, the involuntary leakage of urine, may occur. In some instances, flank pain may occur if the condition causes backflow into the kidneys. Diagnosing bladder fibrosis involves a combination of medical history, physical examination, and diagnostic testing. The doctor will start by gathering a detailed history of your symptoms and any underlying medical conditions. A physical exam may be performed to assess for any abdominal tenderness or other abnormalities. Urinalysis is essential to rule out infection. Aerodynamic testing, which evaluates bladder function, is often used to measure bladder capacity, pressure, and flow rates. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and can identify signs of inflammation or scarring. Biopsies may be taken during cystoscopy to confirm the diagnosis and rule out other conditions such as cancer. While bladder fibrosis is not typically categorized into distinct types, it's helpful to classify it based on its underlying cause. For example, we can distinguish between radiation-induced fibrosis, infection-related fibrosis, and fibrosis associated with interstitial cystitis. Understanding the etiology helps guide treatment strategies. Additionally, the severity of fibrosis can be graded based on aerodynamic findings and cystoscopic appearance, ranging from mild to severe. However, specific formal classifications are not usually applied. Treatment and management of bladder fibrosis focus on alleviating symptoms and addressing the underlying cause. There is no cure for the fibrotic tissue. Medications can help to manage symptoms. Anticholinergics or beta-3 agonists can reduce bladder spasms and urgency. Pain relievers may be prescribed to manage discomfort. Intermittent catheterization may be necessary to completely empty the bladder and prevent urinary retention. Bladder installations, where medications are directly infused into the bladder, can help reduce inflammation and pain. In severe cases, surgery may be considered. Surgical options include bladder augmentation, where a portion of the intestine is used to increase bladder capacity, or urinary diversion, where urine is redirected to an external collection bag. These surgical procedures are typically reserved for patients with severe symptoms that have not responded to other treatments. Lifestyle modifications, such as dietary changes and fluid management, can also help manage symptoms. While preventing bladder fibrosis entirely may not always be possible, There are steps you can take to reduce your risk. Prompt treatment of urinary tract infections can prevent chronic inflammation. Avoiding long-term catheter use, if possible, can also help. If you are undergoing radiation therapy to the pelvic area, discuss with your doctor about strategies to minimize bladder damage. Managing underlying conditions like interstitial cystitis can also help to prevent or slow the progression of fibrosis. The prognosis for bladder fibrosis varies depending on the severity of the condition and the underlying cause. Mild cases may be managed effectively with medications and lifestyle modifications. However, severe cases can be more challenging to treat and may require more aggressive interventions. Research is ongoing to develop new therapies to prevent and reverse bladder fibrosis. Some studies are exploring the use of antifibrotic agents to reduce collagen deposition. Other research is focused on regenerative medicine approaches to repair damaged bladder tissue. Novel techniques for bladder installations are also being investigated to improve drug delivery and efficacy.